Brad Williams, Frugal Finance, CFPB and CMS take actions to stop illegal billing of low-income Medicare recipients. New statements warn healthcare providers, Medicare Advantage plans, and debt collectors about improper billing and collections. Washington, D.C. today, the Consumer Financial Protection Bureau, and this is as of October 31st, 2024, the CFPB and the Center for Medicare and Medicaid Services issued a joint statement to protect millions of people with Medicare living at or below the poverty line from unlawful medical bills. These people in the Qualified Medicare Beneficiaries group represent about 1 in 8 Medicare recipients nationwide. Federal law generally prohibits healthcare providers who accept Medicare from billing these people, referred to as QMBs, for cost sharing, such as copays and deductibles. Medical bills are a major contributor to bankruptcy and filing collapses for a family, said CFPB Director Chopra. The CFPB and CMS are working to ensure that Medicare beneficiaries are not subject to illegal debt collection on improper medical bills. The Biden-Harris administration's effort to make healthcare more affordable are life-changing for millions of Americans, said LaSure. This guidance is part of an ongoing commitment to ensure people have access to healthcare without fear of receiving bills that they should not have to pay. No one should go bankrupt from getting the healthcare they need. The agency's joint statement emphasizes that traditional Medicare providers and suppliers, Medicare Advantage providers and suppliers, and debt collectors can be sanctioned by CMS or be liable under federal law for improperly billing these recipients. CMS is also releasing new resources clarifying that healthcare providers must refund any improper charges, regardless of whether they received incorrect information about a recipient's QMB status from Medicare Advantage plans. The scope of improper billing affects millions of vulnerable Americans despite existing legal protections. In 2021, about 1 in 8 Medicare beneficiaries, 8.7 million people, were enrolled in the QMB eligibility group. There is evidence that some Medicare providers and suppliers improperly seek payment from this population, including when Medicare Advantage plans give healthcare providers incorrect information. These improper bills can cascade into debt collection actions and negative credit reports, creating lasting financial harm for protected beneficiaries and contributing to a medical bill system rife with inaccuracies. Many Medicare beneficiaries with low income struggles with medical costs. About 17% of the thousands of Medicare-related complaints that the CFPB has received over the past several years specifically reference QMB status, and most of these complaints, about 11% of all CFPB Medicare-related complaints, include a report that a healthcare provider or debt collector attempted to collect debt not owed. These improper bills appear on people's credit reports and impact their access to housing, utilities, and other forms of insurance. The risk of improper billing is particularly high for about 1.5 million QMBs who are in Medicare Advantage plans that are not specifically designed for low-income beneficiaries. The joint statement describes the guidance that CMS is releasing today and explains how the laws that the CFPB administers and enforces apply to improper debt collection of QMBs. Specifically, the statement explains debt collectors may not collect on improper and inaccurate bills targeting Medicare beneficiaries. The Fair Debt Collection Practice Act prohibits collecting bills that are not actually owed or are in the wrong amount. Debt collectors may not tarnish credit reports with improper and inaccurate bills. Furnishing inaccurate information may violate the Fair Credit Reporting Act, may also demonstrate that furnishers do not verify the accuracy of information they furnish. The CMS resources outline how providers should verify QMB status and require refunds of any improper payments collected. Providers who bill QMBs for improper charges are violating federal Medicare requirements or their obligations under Medicare Part C and may risk CMS sanctions. Today's actions build upon the Biden-Harris administration's call on state, local governments, and healthcare providers to take comprehensive action to reduce the burden of medical debt. The CFPB has taken a range of actions to address unfair and coercive medical debt collections and practices, including issuing guidance to prevent families from being targeted by illegal medical debt collection tactics and proposing a rule to ban medical bills from people's credit reports. CFPB and other enforcement agencies will take action against debt collectors that violate the rights of patients. Comment if you have any questions relating to improper Medicare Medicaid billing. Brad Williams, Frugal Finance. Thanks for watching. Hope that helps. See you soon.